Hi everyone, welcome back to the PWG channel. We're here today in the Toronto office to break down all things about Canadian healthcare. What makes Canada such an amazing country is that most of the healthcare is universal, which means whether you're a newcomer, if you are a temporary resident, a worker, a student, or a PR resident, you will have access to healthcare services in Canada. What that means is that you don't actually have to pay for healthcare in Canada. The healthcare system here is all based on the tax-paying system. So everyone who lives and works in Canada is required to pay taxes that help build great healthcare facilities and help cover healthcare services throughout for all newcomers. This also includes some provinces and territories that cover emergency healthcare system. So if you are in a 911 emergency situation or you need an ambulance, you wouldn't have to worry too much about having an insurance because the basic necessities is always covered. So most newcomers coming to Toronto are either here as a student or worker. However, if you are lucky enough to have gotten your PR before landing in Canada, you're automatically eligible to the province's healthcare system. However, regardless of whether you're a student or a worker, there are different criteria available for each one of you coming to Canada. In this video, I will be breaking down the Canadian healthcare system so you can have a better understanding when coming to Canada, and your transition will be smoother and you'll understand all things healthcare related. Let's dive into it. So first things first, healthcare in Canada depends on which province you'll be living and working in, as each province has its own set of rules and its own healthcare system to help deliver the best services for their residents. So for some provinces, permanent resident holders can have access to the healthcare insurance right away. However, for some other provinces, you'll be needed to wait at least 3 months before your insurance kicks in and you can start using healthcare services. Here's a breakdown of all the provinces and what type of healthcare they provide, what services they provide, and some of the eligibility criteria. Let's start with Alberta healthcare. The name goes by Alberta Healthcare Insurance Plan, also known as AHCIP. Some of the services included are physician services, psychiatric visits, as well as some diagnostic services that usually are expensive, such as MRI scans or brain scans, as well as certain dental surgeries. The documents you'll need for the Alberta healthcare are the registration form, a government-issued ID, this can be foreign or Canadian, and an immigration status document showing what you are in Canada for. The next healthcare service plan is called Medical Services Plan, also known as MSP, and is actually noted as one of the top services in Canada. You can find this health coverage in British Columbia or Newfoundland and Labrador. The only thing is that this plan only starts 3 months after your arrival or application, so make sure you apply as soon as you land into the province. Some of the services include physicians and midwives, so your pregnancy and your delivery can be covered, dental and oral surgery, some necessary eye exams, x-rays and any other diagnostic services, and some orthodontic services. What's actually amazing is that the MSP used to be served at a monthly premium price, but the government waived that fee in 2020, so it would be accessible to all their residents. The Canadian provinces of Manitoba, Nunavut, and Prince Edward Islands all share the same health care coverage plan. However, only permanent residents and citizens of those provinces are eligible for the coverage. So for foreign workers, I would suggest healthcare coverage will only be acceptable if you land in that province as a PR resident. If you do, they do have a variety of services covered, such as your physician services, surgeries, x-ray, and any other laboratory examination that is needed by a physician. The documents that you will need to provide to get healthcare coverage is a photocopy of a passport, health registration form, and some sort of proof of residency, and you're all set. The healthcare available in the province of New Brunswick is called the New Brunswick Medicare. Applications for this healthcare coverage should be submitted straight to the Medicare website directly. They do not have any third-party affiliation, and you cannot go to any services or government offices to submit your healthcare coverage. Documents needed are application for registration, an official identification document, which could be a passport, or any immigration status documents detailing what your status is in Canada, and an entry stamp on your passport. The healthcare coverage available in the province of Nova Scotia is called the Medical Services Insurance Program. What's amazing is that this province provides first aid coverage to permanent residents moving to Nova Scotia. Not only that, but it's also valid for work permit holders. They're eligible for this plan as well. It starts for them at the beginning of their arrival in Nova Scotia or the date that their work permit was issued, depending on which one is the later date. So for those looking to get insurance on the first day that they arrive and have be covered for themselves and their family, Nova Scotia's health insurance plan is one of the best ones to go for. The government-funded health insurance in Ontario is called the Ontario Health Insurance Plan, also known as OHIP. OHIP is widely accessible throughout Ontario and covers most necessities, so a lot of residents don't actually opt for more private insurances. These services include doctor's visits, things like abortions, ambulance services, even hospital stays. And you'll also be eligible to dental surgery. Did you know that they even cover the cost of travel for health services? It's pretty amazing. The documents needed to apply for OHIP is a completed registration form, OHIP eligible immigration status, which is either a work permit holder or a PR resident, proof that you live in Ontario, which can be shown through your driver's license, any tax assessment or a utility bill that has been sent to your address, as well as an official identification document such as your passport. Lastly, we have the province of Quebec, which typically follows different immigration protocols and policies. In Quebec, their health insurance is called the Régie de l'Assurance Maladie du Québec. I probably definitely wrecked that, but it basically translates as Health Insurance Board of Quebec, also known as the RAMQ. New residents will actually have to wait 3 months to become eligible for this health coverage, so please apply as soon as you arrive in Quebec. For this particular health insurance, online applications are not available, so you will need to visit the Régie office to obtain an application. Please bring all your documents with you so you can complete the application during your visit to the office that very same day. Temporary workers are also eligible for the health insurance, so you can follow the same protocol as any permanent resident. The documents you will need is an immigration document of your status in Quebec, as well as an offer letter or letter of employment, and lastly, a document that states that you may work in Quebec for at least 6 months. And then there you have your health insurance prepared. So now that we know the different healthcare systems in each of the provinces and the services they offer, you can make a better decision as a newcomer, whether you want to stick with the provincial healthcare system or if you want to opt for a private healthcare insurance. Of course, the private healthcare insurance is an additional service, an additional insurance coverage over your provincial health insurance. So with the private health insurance, they provide a variety of services that most provinces don't have, such as prescriptions, therapy, there's a lot of mental health services, there's dental, and some popular health insurance companies to keep in mind when you come to Canada is Sun Life. Sun Life is very amazing for international students, as well as those who have just gained their work permit. There's also Manulife Center and Desjardins. Most employers will also provide additional healthcare insurance. So after your probationary period at work, which is usually 3 months, you can opt to ask your employer to cover your further health insurances at a premium price. That way you won't have to pay for them and you can get access to a multitude of services What's amazing about Canada is that even with the private health insurance, everything has become so accessible. So if you are worried about cashing in and making sure that you're being covered for all these healthcare services, make sure you download the app for each of these health insurance companies, because there's usually a step-by-step guide on how to make sure that your fees, hospital bills are covered by the government so that you don't have to pay for these services. Because at the end of the day, once you're living and working in Canada, you're going to be a taxpayer to this country. So therefore, you are qualified and eligible to access the healthcare services that Canada provides. However, if you are here merely as a traveler or are still in process and waiting for your work permit, the best case scenario is to apply for a traveler's insurance, because provincial healthcare and these private health insurance won't be applicable to you until you become a permanent resident in Canada. My best option is to go to bestquote.com and type in your case and pick the specific category that you are in Canada for, whether it's a student or if you're working or if you're a traveler, and they typically find you the best policies available for you so that you can be covered during your stay in Canada. Of course, our consultants in PWG are also available here if you need further access and understanding about which healthcare system works best for you and your family and which province is best suited for your case. That way, when you arrive to Canada, you can feel comfortable and safe knowing that your stay here is fully covered by the Canadian government and that you won't have any further issues when it comes to your medical concerns. So there you have it. That is the Canadian healthcare system broken down into one video. We did go briefly around all the provinces and the criteria needed to be eligible. However, if you have any further questions or if you're already in a province and experiencing some concerns or issues, feel free to shoot us a message and we're right here to help you and make sure your transition in Canada is as smooth as possible. We're here every week giving you immigration updates and news and lifestyle in Canada. So let us know what you would like to see next. And feel free to give us a like and subscribe for more content like this. We'll see you next time.